So today, really sad case. This poor woman has been suffering for decades.
I have been suffering for decades.
Today I'm working on someone that's getting a twitching right eye and pain on the right side of her face. So I've done a history and I've palpated before I got her on the table, and there's noticeable tightnesses and toned up muscles on the right hand side of the face. So I'm going to be working on reducing all of those and then doing a little bit of craniosacral just for the head. And my client also wants me to do some energy work, so I'll add that in at the end. As I look at her face, I look down her nose and see where her chin is, and her chin is currently slightly to the right, so that adds to the fact that there's tightness over there pulling her chin off track. Did you know the strongest muscle in the body is underneath my fingers right now? It's called the masseter, and it's involved in chewing. So no putting fingers in mouths.
What about the cup I have? Bite me?
Ah, yes, I have a cup. I made her some tea, and on it is a picture of a shark, lots of teeth wide open, and it says bite me. I ask clients to do something after I do work like this to make the jaw more mobile, freer. Just imagine, these are the teeth hanging down from the jaw and hanging up, right? And this is inside the mouth. You put your finger inside to that point there, and then you wiggle it back and forth. And if you do that for 30 seconds, it will relax and allow your jaw to open up more. So these are your teeth, and teeth there, and you just go in between to the back wall, both sides. What it feels like when you do that is like it's bone. It's that hard. I mean, that's actually, it feels like two bones, two bumps, but they just melt. 30 seconds of doing that. It's tight in there. One smart way to use the body is to ask the client to open their mouth, because then the brain says, oh, I need to relax this muscle. And so you can help to stretch it. However, you've now stretched the muscle, so it makes it tight in a different way. Yeah, and as I look down along her nose, her jaw is pulled even more to the right as she's doing that. Now this could get painful, because the fact that her jaw opened more to the right says it's really tight on this side. And so that muscle that I'm trying to stretch is kind of stuck. Loads of adhesions. So to break that up, you really have to push hard against it along the length of the muscle. And if you do things like that, you lose clients because it hurt and they're not going to come back again. So I'll do it gently, but for longer. Sometimes at quiet moments like this, I'm sensing what's going on within the muscle. And if I yawn, it's telling me there's a lot of emotional stuff buried in that muscle as well. I'd also noticed below the ear, it was tight on this side, but not the other side. So I've got to do more work in this entire area. I have to be careful because I can't go doing anything in the area of the carotid and jugular veins, which are down the side here. But I know in here, the styloid process, it connects to the Adam's apple. You don't want to be shaking anything. So you just grab and you pull apart. It's not just muscles I'm working on, it's fascia as well, all the connective tissue. So if you ever see me touching two spots and you're thinking, there's no muscle there, yeah, there's fascia. Before working on the client, I did a neck stretch. So I'm going to do a little one right now, just for completeness. Lift your head, please. Yeah. So before working on anything like this, a neck stretch. It's nice, it's easy. Everybody loves a neck stretch. So 5 minutes, well worth it. And adding in an extra one like this it helps to consolidate the work I've done so that anything that's now looser or relaxed is now getting stretched. This area here, there's a muscle that goes underneath this bone here, down here. And so I palpated, and so it was tighter up here, so I need to work this one, temporalis. And it's a neat muscle because it goes underneath a bridge. And so there's this bridge here, and it slides, the tendon goes underneath there. So how could I massage something that's underneath a bone bridge? Easy. You ask the client to move her mouth, to open her mouth, and then that pulls that piece underneath. And so now I'm working that bit that's protected by the bone. So I'll do that for a little bit, and then in a minute or so when she closes her mouth, it'll just slide back underneath there, and I'll work the rest of it. I'm looking down her nose, and yes, the chin has moved a little bit over, so this is good. I still think there's more we can do here. So next would be some craniosacral just for the head. Right, so head up, and so. So it's always good to start with a sub-occipital release. That's because the jaw fits into the bones of the skull. So if the bones of the skull are slightly out of position, where's the jaw going to go? I can't immediately jump to those bones because the whole skull's kind of locked into place. So I have to do it in sequence. Okay, so everything's going fine here. So the neck stretch I did earlier and this release is telling me that the neck's not the problem here. I find doing this parietal bone the most difficult of all. I realized some years ago, after working on a number of people and going back to the area I worked on, finding it was still tight, tensed. It's like, okay, what's going on here? And I realized it's the brain that's doing it. It's sending signals to that particular area, telling it to be careful, beware, protect yourself, be on alert. All right, we're getting close to the ears now. So that's why I included more energy work, because I could speak more to the brain. It's not the same as speaking to the mind, you know, that's me having a conversation with somebody. But the brain has all these automatic reactions, responses. The lizard brain, for example. Finally, we're getting to move that bone, or those bones, into which the jaw fits. And there's so many directions you can choose. Because you're pulling on the ears, you can pull out more, back more, up more, down more, some combination thereof. The lizard brain, deep at the base of the brain. And so by extending my energy inside, I can get in touch with it. And I will then feel that inner part of us that just reacts, that's on alert, that hides in the dark, scared of things that go bump in the night. All right, well, yeah, I just got a whole bunch of stuff going up here and also in my ear as well. There was some tightness going on there. All right, so for you, in your own time, just pull on your ears in different directions, mostly backwards. I think that would be help to, because yeah, I can't go inside the ear. And be careful using Q-tips. All right, back I go, back to this lizard brain. And it just feels like something smashed against the side of my head, which would cause a whole bunch of fascial tightness. And it could happen at any age, as a kid. Listening to what's going on helps the tissues to let go, so they relax afterwards. It's not like I'm doing anything to the tissues, I'm just listening and feeling and experiencing what they're going through. And then you kind of go, ah, someone's listening. because usually it's not the client. Well, how's it feel?
Good.
All right.